Have you ever wondered why some women experience debilitating pain during their menstrual cycle? Could it be more than just bad periods? This may sound like a mystery, but it's a reality for many, a condition known as endometriosis. Often hidden in the shadows, it goes undiagnosed due to lack of awareness. It's a silent struggle that affects countless lives, often leaving individuals feeling isolated and misunderstood. Today, we dive into the world of endometriosis, a condition that affects 1 in 10 women globally. Scene script. First, let's explore what endometriosis is. Endometriosis is a medical condition that occurs when tissue similar to the lining inside the uterus starts to grow outside the uterus. This misplaced tissue can be found on the ovaries, fallopian tubes, or intestines, and in rare cases beyond the pelvic region. This tissue, regardless of where it ends up, behaves like the tissue found inside the uterus. It thickens, breaks down, and bleeds with each menstrual cycle. However, unlike the tissue inside the uterus that leaves the body during menstruation, this misplaced tissue has no way to exit. This leads to cysts, also known as endometriomas, and can cause irritation, scar tissue, and adhesions, which are abnormal bands of fibrous tissue that can cause organs to stick together. Now you might be wondering, what causes endometriosis? Well, the exact cause is still a bit of a mystery. Some theories suggest it's due to a process called retrograde menstruation, where menstrual blood containing endometrial cells flows back through the fallopian tubes and into the pelvic cavity instead of out of the body. Other theories include immune system disorders and hormonal imbalances, but more research is needed to fully understand the causes. The symptoms of endometriosis can vary, but the most common one is pelvic pain, which is often associated with menstrual periods. Many women with endometriosis experience cramping that's far worse than usual, and it can last longer than the typical few days of a menstrual period. Other symptoms include pain during intercourse, bowel movements or urination, excessive bleeding, and even infertility. Endometriosis can significantly affect a woman's daily life. It's not just about the physical pain, but also the emotional and mental toll it can take. It can interfere with work, school, relationships, and overall quality of life. The discomfort and uncertainty of living with chronic pain can lead to feelings of frustration, depression, and anxiety. The pain can range from mild to severe and often syncs with the menstrual cycle, but for some, it's a constant companion. Now that we understand what endometriosis is, let's shed some light on how it affects those who live with it. Endometriosis, a condition where tissue similar to the lining of the womb starts to grow in other places, such as the ovaries and fallopian tubes, can manifest in various physical ways. One of the most prominent effects is chronic pain. This discomfort can be constant, or it might coincide with a woman's menstrual cycle. The pain can be debilitating, affecting the lower abdomen, lower back, and even the legs. Heavy periods are another common physical effect of endometriosis. Women with this condition often experience heavy and prolonged menstrual bleeding. This can not only be inconvenient but also lead to anemia, a condition characterized by fatigue and weakness. Fertility issues are also linked with endometriosis. The abnormal growth of endometrial tissue can interfere with the function of the ovaries and fallopian tubes, making it difficult for some women to conceive. However, it's important to note that not all women with endometriosis experience fertility problems. But the effects of endometriosis aren't just physical. The condition can also have significant psychological impacts. Living with chronic pain and the uncertainty of a complex disease can lead to feelings of anxiety and depression. The struggle to conceive can add another layer of emotional stress. Moreover, the invisible nature of endometriosis can lead to feelings of isolation. Women with this condition often report feeling misunderstood or dismissed by others who can't physically see their pain. The stigma surrounding menstrual health issues can further intensify these feelings of isolation. Endometriosis can significantly impact a woman's quality of life. However, it's crucial to remember that with the right knowledge and support, it is manageable. The journey may not be easy, but understanding the effects of the condition is a step towards taking control of it. The more we know, the better equipped we are to support those living with endometriosis and help them lead fulfilling lives. Endometriosis can significantly impact a woman's quality of life, but with knowledge and support, it is manageable. Pain management is a crucial aspect of living with endometriosis. It's not just about popping painkillers. When it comes to managing endometriosis pain, there is no one-size-fits-all approach. Rather, it's about finding what works best for you. Let's explore a few strategies that can help. Hormonal treatments can be a game changer. They work by reducing or stopping the production of estrogens, a hormone that fuels endometriosis. This can slow the disease's progression and alleviate pain. Options range from oral contraceptives to progestin therapy and GnRH agonists. These treatments can have side effects, so it's important to discuss them with your healthcare provider. In some cases, surgery may be recommended. This can involve removing the endometriosis lesions or, in more severe cases, performing a hysterectomy. While surgery can provide significant relief, it's not without risks and doesn't guarantee the pain won't return. Physical therapy is another tool in the endometriosis management toolbox. A skilled physical therapist can help you strengthen your pelvic muscles and learn relaxation techniques to manage pain. They can also guide you in exercises that can alleviate pain without exacerbating the condition. Lifestyle changes, though often overlooked, can make a significant difference. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can help reduce inflammation, a key factor in endometriosis pain. Regular exercise can also help by improving blood flow, reducing inflammation, and boosting your mood. Remember, it's not about intense workouts, but rather consistent, gentle movement. Finally, don't underestimate the power of a strong support system. Connecting with others who understand what you're going through can provide emotional relief and practical advice. So as you navigate your endometriosis journey, remember this: there are many tools at your disposal to manage pain. Work with your healthcare provider to find the right combination for you. Remember, every woman's experience with endometriosis is unique, and so should be her pain management plan. As we wrap up, let's summarize what we've learned about endometriosis. It's a condition where tissue similar to the lining of the uterus grows outside the uterus, causing varying degrees of pain. The effects of endometriosis can be physical, mental, and social. Fortunately, there are several methods for managing the pain, including medication, lifestyle changes, and sometimes surgery. Remember, endometriosis is a common condition, and if you or someone you know is experiencing these symptoms, do not hesitate to seek medical advice. Knowledge is power, and with the right support and treatment, you can manage endometriosis effectively.